Hi, my name is Amanda Rodriquez. I'm 21 years old and I've had 2 left knee surgeries. One was ACL, the second one was ACL and lateral meniscus. So before surgery, a lot of nervousness. I was a nervous wreck just for the anticipation, especially for the first one. I didn't know what was going to happen. I was thinking everything that could go wrong, so it was really scary for me. Once we actually got to the day of surgery, I had a lot of help with my doctors. All came and saw me, the anesthesiologists, the nurses. They all reassured me they're there to help me the whole time. It was a little scary because the IV got placed in me wrong for the first surgery, so I started panicking, but they fixed it, got that all rearranged, got me nice and comfortable, took me into surgery. Next thing I remember is waking up in the recovery room all by myself, and the nurses were really nice and helpful. They get me out of there nice and safely and comfortably. After surgery, the first couple weeks is a lot of pain. Pretty much just on your medication, doing basic things, trying to go to the restrooms really hard by yourself, trying to take a shower, just basic things that you never knew were so easy for everyday life. My biggest concern that I had going into knee surgery was, one, living through it. You know, you've heard about the cases where people don't make it through. 2 was actually getting my ACL fixed. I wanted to make sure that the surgery worked and I wasn't going in for nothing. Outside of surgery, healing, I wanted to make sure I healed and didn't tear it again, which obviously didn't work since I tore it twice. And one of the biggest things was for my future-wise. I was planning to get a scholarship to play soccer, but I actually tore my ACL the first time 3 weeks before a big showcase where I could have been recruited. And the second time was my senior year of high school, which just shadowed any chance of playing for college. So that rearranged my whole future plans. But on the bright side, I got to figure out what I wanted to do in the future as a career. The process before surgery starts with your doctor clearing you. Then he sends you for some blood tests. After you've been cleared, you wait till the day of surgery. Surgery will last anywhere from an hour and a half to 3 hours, depending on what kind of knee surgery you're having. The day after surgery, you visit with the doctor to make sure everything went well. And then from there, within the first 4 to 6 weeks out of surgery, you'll start physical therapy. And within that time, you'll have gradual doctor visits until you're all better. Before surgery, the one thing that I would have changed was doing all my prehab workouts. And after surgery, there really isn't anything that I would have changed. Yes, after the first surgery, I experienced a little depression. Kind of halfway through my physical therapy, I hit a plateau, and when you start not to see results, when you're trying to get better and better and better, it got really hard to keep going, but I pushed through it. For the second surgery, it was way harder. I was really hard on myself. It was a big mental challenge, and I feel like I experienced more depression in that sense because I knew not only did I have to go through everything I've already gone through the first surgery, but I knew my future plans for playing in college weren't where they needed to be. I knew pretty much any future dreams to play at such a high level that I used to play were over. So it was more of a mental process to get out of a slight depression, you could say, and push through to just keep getting better.